Delighted to be here. This is an exceptional occasion and something that we should all feel very, very proud of. My name is Mike Dowling. I'm the president and the CEO of the North Shore-LIJ Health System. As you know, we're one of the largest providers of healthcare in the region, including Queens. And we are absolutely delighted to be celebrating the opening of the new Queens World Trade Center clinical program here, which is a relocation from a smaller space in Flushing. We have here over 3,600 square feet. And as you all know, this is the result of a federally funded program. There's a Droga Health and Compensation Act, which got a lot of attention recently in the newspapers, as people know. North Shore-LIJ and the Long Island Jewish Medical Center got a portion of that money to provide mental health and health services to World Trade Center responders. These are people whom we all know very, very well, who helped enormously during the World Trade issue and put their lives at risk and obviously need the ongoing support and help and services. And we are delighted as part of North Shore-LIJ to be able to provide this facility here. This will be much more conducive to the needs of the people who come here. It's a much larger space. It will have more staff complement here. In a few moments, you will hear about from the person who will be running this facility, Dr. Jackie Moline, who has actually been involved with this program since its inception years ago. And actually, it was at another healthcare system years ago, which Jackie also was running. So this is something to be very, very proud of. We're delighted to be here. It's a big part of what North Shore-LIJ does as the largest provider in the region. And without further ado, it is my privilege to introduce a couple of speakers. We do have here somebody that is very well known to everybody in this borough, who has been a wonderful supporter and advocate for healthcare for the borough of Queens, and somebody that I've known for many, many, many years. I won't tell you how long, but knew her quite well before she was Queens Borough President, and that's Helen Marshall. We also have Laura Lee, Helen Marshall.
Okay, thank you. I'm glad to see that you're also going to work with mental capacities. A young man, many of the students at Stuyvesant saw the people jumping out of the windows, and for some of those kids, it was such a tragic thing to see. And this particular youngster, his father brought him to the school, to my office, and said that my child, who was so brilliant and so loved his school so much, now he doesn't want to go to school, and so he's having all kinds of problems. So that age group, I think, really needs some help. And so I'm very happy to know that you're going to work on the mind and their soul. Okay. Good morning. Thank you, Michael, for that kind introduction, and thank you for the invitation to be part of this very special event. Queens is proud to be the borough with the largest number of responders. And under this new federal legislation, we will be able to provide services to our responders at this site until at least 2016. Okay, that ought to do it. All right. These federal funds will help continue the provisions of services and programs for those who served so bravely and selfless on 9/11. Their physical, emotional, and mental well-being depends greatly on our ability to link them with the services that they so richly deserve. I am proud to be here today, and I want to congratulate the LIJ Medical Center and Queens College.
At the beginning, she's the director of this program here. She's also the vice president and the chair of population health for the North Shore-LIJ Health System, and an expert in this arena. And her advocacy in a big way plays a major, major role in us being able to have this program here. And we're delighted. So Jackie, thank you.
Thank you, Mr. Dowling. And there are many people to thank. I'd like to thank the borough president for coming here, and to all those folks who are here. There are many people to thank for us being here today. First and foremost are our responders, for whom we have worked since September 12th, 2011, when we knew there would be issues, and began plotting how we would develop medical programs to deal with the medical consequences of September 11th, because we knew, in fact, the air was not safe to breathe. I'd like to acknowledge our partners at Queens College and Dr. Stephen Markowitz, who ran the program before our partnership began in 2011, with LIJ becoming the lead partner. You know, there have been a variety of health effects related to the World Trade Center. We've seen health effects from the very onset, with people having trouble breathing, people having the World Trade Center cough, people having problems with sinus congestion and nasal congestion, people having PTSD or post-traumatic stress disorder, not wanting to go back to the borough of Manhattan, which is why it's so important for there to be locations in other boroughs for people to get care in the areas where they live or work. Some folks do not want to go back to Manhattan because it brings back too many bad memories for them. That was, in fact, one of the reasons why, when we were establishing the programs, that we wanted to have regional locations of centers of excellence so that folks could get care closer to where they lived or worked, without worry of exacerbating any symptoms they might have. This new facility is really a wonderful partnership, and there are so many people to thank that I feel like it's an Academy Award speech. We feel so passionate about these programs. These folks did such a tremendous service. They went in, they were there without thought of what it might do to them, and many of them have long-lasting health effects. Their lives have been changed forever as a result. Some of them can no longer work because of what they were exposed to at 9/11. From the toxic mixture of chemicals. One who's going to speak today, we're thrilled she's here, is Shore-LIJ Sander, who is a retired NYPD detective, and she's going to give us a few words about the program and what it's meant to her.
Okay, I want to thank everybody for this opportunity to speak about the program, because it is a wonderful, wonderful program. I started working down at 9/11 the day of, but in the surrounding area, and then did various other tasks. The third day I was at the site itself, and it was a very devastating thing, but a very necessary thing to attend and to help get back people to get back on their feet, back in order. On the third day, I spent 12 days there. And on the 12th day, I developed a breathing problem. I couldn't catch my breath. So EMS was called, and they gave me oxygen, and I was whisked off to the hospital, and I spent 2 days there, at which point they released me to the care of my physician. Since then, I've had breathing difficulties, a lot of coughing. I've had GERD and sinus problems. And I originally started down at Mount Sinai in Manhattan, but with the opening of the Queens office, I was able to come, and I'm very grateful. I have a wonderful physician. The staff is wonderful, all of them, including clerical, the nurses. I just can't tell you how pleased I am with the program. And I encourage anybody that has difficulty that was down there to also take advantage of this. I think that's about it, what I have to say. And is there anything else I can add? Very grateful. Once again, thank you so much. Thank you.
Well, I thank you so much. Thank you for being here. If there are questions, we can take some questions now. Jackie Moline can answer any question, able to participate in this and provide the kind of necessary services. And as Jackie mentioned, this will be in place through 2000. So thank you all very, very much. But if there are any questions right now, Jackie will take them.
It's larger. It's there's a subway line that's right across the street for folks. There are bus lines that are also here. The biggest change is that we have more exam rooms and the ability to accommodate all our staff on one floor in one location, and we'll be able to see more patients.
Look up when you cut. Look
Somebody
at me.
has to give the count.
Okay, I will. Okay, look at me. Look up right here. Everybody, look at me. And on 3, you're gonna cut. 1, 2, 3. Look at me. Look at me.
Didn't get it?
Let's do it one more time.
I was looking at a lot of other people.
Look at this lovely lady right below me here. Keep looking up. And look at me right here. On 3. 1, 2, 3. Go, go, go. Good. We got it. Ribbon in midair.
Thank you all
We have
very
some
much.
light
Yes.
refreshments if anyone's hungry, thirsty, come on back in.
Start by telling us your full name
Martin Grillo, Grillo,
and your title or what you were doing.
I'm a retired Port Authority police officer and paramedic, and I responded on 9/11 right after the second towers collapsed.
Okay, Betty was telling me a little bit about your story. So why don't we start with that?
About on 9/11, I like I said, I'm retired from Port Authority police, and one of the assignments I had was the World Trade Center. And we went down there and was not really prepared to see what we saw. I ended up wandering around for a little while aimlessly, and we came around to VC Street, and there was a Cornell ambulance, and I had worked at Cornell as a paramedic. And I got in the ambulance and started looking around. This is great, there's equipment. And I realized the crew's cell phones were there ringing, and their newspapers and their lunches, their helmets were gone. I knew they were gone. Before I could think anymore, a Secret Service agent who turned out to be a paramedic also took a patient, put him in the front seat, and 2 critical patients, put him in the back. And I drove that ambulance down to the Staten Island ferry with a private ambulance, took the patients we had to the hospital, and we went back and spent most of the day there trying to see what I could do. I got my eyes washed out about 5 or 6 times from the debris, and I was back almost every day involved somehow because of my being retired from the Port Authority. I had a lot of access to a lot of things, which helped the responders get their jobs done a little more efficiently.
Okay, so just give me 1 second because my volume's a little bit low. So you returned several times.
I was there almost every day until January, doing some of there was people who worked at Cornell where I worked at the time, or had left from, who were involved with the military. We were doing a lot of back interoperability, so to speak, trying to help people get equipment and supplies, sometimes through the back channels because the forward channels didn't always work.
What type of illness did you develop as a result of working at Ground Zero?
I've got what they call GERD. I've got, they call it asthma, a reactive airway disease, so I've had problems breathing at times on exertion. I have sleep apnea. Those are the ones off the top of my head right now from that.
You weren't thinking about yourself, obviously. When you
Never did. That was my problem. And when I teach now, it's one of the first things. As I'm a paramedic instructor, I make sure I teach our students that you have to go home the same way you went in. Otherwise, you failed your mission.
And what does it mean to have a program like this one here in Queens now?
This program is very professional and very attuned to the needs of the people who responded. And like I said, I was very lucky. I didn't have any signs of anything almost till 6 years after the event. First was monitoring, and then it became treatment. But once they realized there was an issue, the treatment started pretty much immediately, and they've been following up. And it's a good thing in the back of my mind knowing that this is here to be able to take care of us.
Martin, how important is a place like this to be able to come here? How vital is that?
Very, because it's sometimes we feel, a lot of us feel that we've been forgotten to a degree. And this is showing that the people are remembering that we're still around and there are still a lot of effects. I've had plenty of my friends who didn't die on that day, have died over the years, whether it was due to lack of treatment, a lack of being able to find out what was wrong with them. But we need this as a very vital resource to remember what all those people did that day.
to us it looks, you walk around here and it looks like just like kind of a doctor's office, but what is it to you walking around seeing these new facilities and more space?
It's just showing that there's a commitment to the 911 responders.
Great. Thank you.
Thank you.
I'm up to duty for 35 years. I sit on remand. I retired in 97.
Do you know Dr.
That name sounds familiar. Yeah. Oh, sure. Yeah. I used whatever, so before the ambulance became a detail, whenever there was an ambulance call, they were dealing with.
We used to have a joint venture between the ambulance and our paramedics.
Which I was when Dr. Starr was still there.
Ah, wow. So you retired.
Now, if it was Greg, I retired on the road nowadays. On track, and my guy, a lot of my friends just retired, they just served their retirement. Who was it?
Mike Veneri.
Mike is good. Mike is good.
Yeah, Mike is a good guy. Dante?